Hello and welcome. If you're here because of severe, persistent abdominal pain, you already know just how much it can take over your life. So today we're going to talk about a procedure that offers a lot of hope for relief. It's called the Celiac Plexus Block.
You know, for anyone living with a condition like chronic pancreatitis or pancreatic cancer, this feeling is all too familiar. It's this relentless, draining presence that can really just overshadow everything.
I think a good way to think about it is like this. Imagine the pain signals coming from your organs are like a faulty car alarm that's just stuck in the on position. It's this exhausting, constant state of alert that your body is forced to live with.
That's really the key question, isn't it? If we can just find the control panel for this alarm, maybe, just maybe, we can quiet it down. To do that, we need to understand exactly where these pain signals are coming from.
Well, deep inside your abdomen, there's a really dense bundle of nerves. It's called the celiac plexus. You might have also heard it called the solar plexus. And you can think of it as a central switchboard, or, the main control panel for a lot of the pain signals coming from your upper abdomen.
And this control panel, it's connected to so many key organs in that area. It's relaying messages from the pancreas, the liver, your stomach, your small intestine, and others. You know, this really helps explain why pain from something like pancreatitis can feel so overwhelming and just so widespread. It's all being broadcast from this one central hub.
And that brings us right to the purpose of the procedure we're talking about. The goal isn't to damage anything, it's not about cutting any wires. It's about gently and safely turning down the volume of that overactive alarm system to give you some peace and quiet.
So how do we actually do that? How do we turn down the volume? Well, the procedure is the Celiac Plexus Block, and the concept is actually very direct. A specialist very carefully guides a thin needle to that bundle of nerves. Then a small amount of medication is delivered right there to just kind of bathe the nerves. And this medication calms them down, interrupting that constant firing of pain signals.
Now, something that's so important here is how precisely this is all done. You know, in the past, these techniques were often done blind. But today, it's absolutely the standard of care to use imaging guidance, like a live X-ray called fluoroscopy, or maybe a CT scan. In my experience, using this kind of imaging isn't just best practice, it's essential. It allows the physician to see exactly where that needle is in real time, making sure the medicine goes to the precise spot where it can do the most good. And this level of precision, it's just so key. It's a very controlled, deliberate procedure, and it's always done by specialists who really have a deep understanding of the anatomy and the technique involved.
For the procedure itself, you'll be made as comfortable as possible, usually lying on your stomach, maybe with a pillow for support. And this position just gives the doctor the clearest and safest path to the celiac plexus. So, okay, we've talked about what it is and how it's done. But that brings us to the most critical question of all, right? Does it actually work?
Well, the evidence is incredibly encouraging. One large analysis of many different studies found that somewhere between 70 and 90% of patients with cancer-related pain got significant, lasting relief. I mean, that is a powerful number. It's a number that offers some real, genuine hope.
But you know, effective pain relief is only part of the story. It's also about quality of life. When you compare it to just managing pain with opioids, studies show that a celiac plexus block can give similar levels of pain relief, but, and this is a big but, often with far fewer side effects. And that can mean a much better quality of life and maybe even reducing the need for high doses of pain medication.
Of course, with any medical procedure, it is absolutely right to ask about the potential downsides. It's so important that we have a clear, honest look at what the possible side effects might be.
So the most common side effects are usually temporary and manageable. Things like a temporary drop in blood pressure, maybe some soreness in your back, or even diarrhea, all things we can manage. But the crucial point here is that while these minor things can happen, serious complications are very, very rare. We're talking about 1 in 700 patients, roughly.
So when you put all of this together, the high success rate, the manageable side effects, what it really points to is more than just clinical data. It points to a real possibility of meaningful relief. A chance to finally turn down the noise of that chronic pain so you can get back to focusing on the people and the moments that truly matter.
So, if any of this is resonating with you, if this sounds like something that could be relevant to your situation, what's a sensible way to move forward?
Honestly, the very best approach is to see this information as a starting point, not the final word. A celiac plexus block is a really important option to know about, and the next step is a simple one. Just have a conversation with your doctor or your pain specialist. Talk with them and explore if it could be a fitting part of your personal care plan.
Because at the end of the day, never forget that you are the most important person in the room when it comes to your health. Thank you for taking this time for yourself and for learning with us today.